and information webinar. I would like to introduce you to our guest speaker, Gurmeet Meghera, Manager of Simulation Lab, BPSO in Wound and Skin Care at Humber River Health. Gurmeet has contributed significantly to HRH since 2002, showcasing a diverse and extensive career. In her various roles, she has actively participated in numerous corporate initiatives, demonstrating her commitment to driving organizational success. Throughout her time at HRH, Gurmeet has demonstrated her versatility by taking on roles such as a registered nurse, resource nurse, intern manager, clinical practice leader, inpatient surgery, and the clinical simulation lab. She has not only provided guidance and support to nursing staff and interprofessional teams, but also has implemented evidence-based practice guidelines and made valuable contributions to quality improvement initiatives in patient care as a dedicated leader. Gurmeet completed her BSCN in nursing 2011, followed by a master's in nursing specialized in teaching and learning methodologies in 2021. She has obtained a certificate in medical surgical nursing in 2010, and she's completed the Simulation of Nursing Education Certificate Program with the Canadian Association of Schools of Nursing, which has equipped her with a specialized training and expertise in implementation of simulation-based education. Gurmeet currently serves as the manager of the Clinical Simulation Lab, BPSO lead, and Wound and Skin Care. In this capacity, her focus has been on creating and delivering simulation-based training and educational programs for healthcare professionals, both new and existing. Gurmeet also plays a role in supporting HRH in BPG implementation and sustainability, as well as overseeing pressure injuries for all 3 sites. As you can tell, Gurmeet is very enthusiastic for acquiring knowledge and contributes to enhancing the learning experience for those inspiring to become successful members of the healthcare team. And we are honored and delighted to have you here this afternoon with us, Gurmeet. Thank you for being here. And I would like to pass it over to you now.
Thank you so much, Yulin, for lovely introductions. So on behalf of Humber River Health, I would like to thank you, RNAO, for providing this opportunity to share our experience of empowering a best practice champion to lead the way. So objective of this webinar is, the end of webinar, our participants will be able to understand how to embrace the role of best practice champions and lead with confidence. And throughout the presentations, we will be focusing on 3 key objectives here. So exploring methods for developing the best practice champions within your organizations, share success stories from here, how it has impacted and empowered our best practice champions, and fostering a supportive learning environment where participants can exchange ideas and best practices for developing champions within their teams. So throughout the presentations, our focus will be of these 3 objectives. So a little bit background of Humber River Health. So Humber River Health is one of the Canada's largest acute care hospitals, fully digital, and serving a diverse catchment area of more than 850,000 people in the Northwest Greater Toronto area. HRH operates 729 acute inpatient beds with 2,900 clinical staff, 1,500 multidisciplinary staff members, 794 physicians, and almost 500 volunteers. So across the 3 sites, we have more than 1,200 beds opened, actively admitting our patients and providing care. So in October 2015, we have opened Wilson site, which is a fully digital site with 656 bed. And then within 2 years, we opened Finch campus as a reactivation care center, where 3 other hospitals, they are partnered with us, Mackenzie Health Center, Oak Valley Health, and South Lake. In 2018 to 2019, we opened Church Site Reactivation Care Campus, where we have 259 bed. And then we have 4 other partners with us, Sunnybrook, William Osler, Trillium Health Partners, and St. Joseph. So our journey from Humber River Health as a best practice champions or organization started back in October 2018. We got our designated as a BPSO designations in April 2021. As everyone knows, being a BPSO designations, it's renewable every 2 years. And there are a lot of commitments to keep that designation. So we got renewed in April 2023. So as a designated BPSO, HRH is committed to focus on sustainability, continue implementation and evaluation of best practice guidelines, and ongoing development of our staff as a BPSO best practice guideline champions. So within this journey, over the 6 years now, so we are able to implement 10 best practice guidelines. We started our journey back in October 2018 with 3 best practice guidelines: pressure injury, care transitions, and pain management. And then in 2019, we implemented delirium dementia depressions, patient family-centered care, and prevention of falls. And then next year, 2020, we were focusing on palliative care, then breastfeeding. And then this year's March 31st, we launched vascular access as a corporate PPG here. So on the 6th of May this year, first day of nursing week day, we got an honor to launch digital health BPG here in our hospital. And then our next step, we are working on substance use and ostomy care within the next 2 years. So this is how far we are with our journey since October 2018. So going back to our objectives, so we are going to talk about how we will be able to develop our champions. What are the different methods we have used here? So our journey starts for the developing best practice champions as our staff are newly hired in the building, so onboarding staff. So our nursing staff orientation is 8 days. So it's based on in-class simulation-based orientation methodology. So first 2 days are corporate orientation, and then nursing orientation starts from day 3 to day 8. So on day 3, we will be encouraging our staff to create an RNU e-learning account, which is going to be helpful for the next 5 days when they are with us. So on day 4, we incorporated best practice guidelines into our new staff orientation onboarding. What that means is we are asking them to complete the best practice champions e-learning module with RNU starting from day 4, and then it's a requirement of the orientations. They will be finishing their program or the modules by day 8 and submit certificates to us. So this is done within the orientation. So then they will be working on these modules for the 5 days. So during orientations, we focus on 7 best practice guidelines formally. These sessions are dedicated in orientations within certain amount of time, 1 hour, 2 hours, depending how much time is needed. Hands-on simulation activities are for many of these BPGs are implemented within the orientation program. We also do pre-survey to assess their knowledge, how much they have knowledge about the best practice guidelines, or what it means is to become a best practice spotlight organizations and best practice champions. So the survey is done on day 3, prior to the orientation start as a nursing, and then we do on day 8 at the end of the orientations, and I will share the results in this presentation. So formally, we focus on 7 best practice guidelines, but we also talk about the digital health. Being a digital hospital, a lot of technology is used. And throughout the orientation, we focus on digital health, as well as patient family-centered care best practice guideline also. So by exploring these different methods of developing champions here, as well as it may help you on your organization. So we also host 2 interprofessional team best practice champion open house or workshop annually. So one is usually done in November, and then other we plan in March. For these workshops, we use the leading change toolkit from RNAO to guide the change. We also go through PDSA cycle, which help us to assess the educational needs for our staff. It also help us to identify what objectives we are going to be creating for those presentations, and we collaborate with key stakeholders who are going to lead those sessions when we are doing the open house. We also integrate change management framework from Rogers to utilize, facilitate acceptance and adopt, and then sustain the best practice initiatives. So these 2 annual workshops, they are 8 hours paid education day for the staff member. And then usually our focus is for 4 best practice guidelines. Again, those 4 best practice guidelines, we go through the pre-survey by assessing educational needs and then where the gap is, what is the key things going on into the organizations right now, and what is the need for education. So that's where we focus. We have 10 best practice guidelines, so we will choose 4 out of that. And then we will be connecting with the key stakeholders, and then those key stakeholders, whoever those will be, they must be our new best practice champion to understand how much work is behind to implement one best practice guideline and what is their role to sustain it. Then we prepare the content, and then a week or 2 weeks before the open house or workshop, we will be running a mock presentations with the presenters to understand their timelines, what activities are integrated there, and then if there is something needs to be changed or modified. Then on the day of the workshop or the open house, we will be setting up 4 simulation stations. Of course, this will be helpful when we have an incentive for our participants. We give them certificates for the attendance. This is a paid day, as I said. They will receive a t-shirts, pen, gift cards, and then lunch and morning and afternoon refreshments will be provided. Then we will be doing a post-workshop evaluation. Based on the evaluation, we focus on improving opportunity. That is our key piece. And then our goal is to integrate those improving opportunities in our future workshops. So this is the example. Last year, we did the open house in November 2023. So this was 8-hour sessions. We have agenda. We created an activity handbook for them, and we adopted best practice champion competency checklist from RNAO. And our focus at that time was these 4 best practice guidelines: pressure injuries, pain assessment and management, prevention of falls, and triple D in older adults assessment and care. So at that time, there was a 40 staff member who attended. Again, this was interprofessional. There was a clerical staff, there was a physio, there was a speech language pathologist, social workers, all mixed interprofessional team. There was a 3 pre-grad students also attended, and there was 11 presenter to present and host these 4 different BPG sessions. We did the pre and post survey, and I will share the results of those surveys also. So this is how the acknowledgement goes. So they get a certificate, they get a pen, which does say best practice champion, t-shirts, and then some cards over there as a gift card. So by the end of the day, these individuals or participants, they were very, very appreciative for the opportunities to be given to them, because this was helpful to mix with other disciplines and understanding. So for example, clerical staff has no idea about the best practice guideline. She does know about the names of the best practice guideline, but what it entails, it was a whole highlighting things for her. Social workers and PPLs or our speech language pathologists, all of them, they were very, very appreciative. So by the end of the day, by attending this workshop. So the next opportunity we got, as I said, one we do in November and one most likely in March. So in March, our goal is most likely is on pressure injury, because the objective of this workshop is a little bit different than the previous one. So this one is to prepare the staff for international pressure ulcer prevalence survey. So this helps us in a 2-way. We definitely, it is going to enhance the staff knowledge who is participants, but it also help us to prepare our staff to do the survey. So this year we took a different approach. If you look at these numbers, we involve pre-grad students. There was a 41 pre-grad students for that semester. We invited them because there were 19 inpatient units where our focus was for IPUP survey. So for the 19 units, there was 3 staff member required for each unit to do the survey. So which means we need 57 of nursing staff. And then every organization has challenge for staffing. So we use a different approach. We approach pre-grad students, so 41 of them. And then if you look at our RNs and RPNs number, only 18 staff member was used. So there was one RN or RPN from the floor and two pre-grad students, team of 3. They were the one on the floor to do the IPUP survey. And the results were amazing. There was support was amazing. They felt kind of thing. And then it also helped us to save our staffing. You can see the clinical practice leaders from those units. They also attended this workshop. So total 71 people attended a workshop of 4 hours to prepare them for IPUP survey, where they have done the wound and skin assessment, staging, dressings, measuring, tunneling, undermining, all of those kind of things they learned in those 4 hours. Our rep from Baxter Hillrom was also on site because this was the first time in Humber, we did IPUP survey online, which means we were assessing the patients at the bedside and we were kind of entering the data at the same time. So those 2 people, students who participates in this, they were at the bedside, for example, assessing the patients and giving all the data to the recorder, which was the staff member, and then it was done on site, on bedside. So these are the people, 71, our pre-grad students, our staff, our CPLs who attended the workshop on March 20th, 4 hours. You can see there was wound models were used as well as the staging was kind of done. And they were measuring the wounds. They were looking at their stage, whatever the stage looked like, so that they can do the survey correctly on the day of the survey. So then the survey day was 25th. So all of those participants, they came back on the 25th. They got a t-shirt which says best practice champions at the back. And then they went to the floors. They were buddied with their team members, 3 of them. And then they were collecting the data. By the end of the day, they got their certificates. Of course, this was also paid day. Students got their hours counted here. So we signed off their hours for 8-hour participant here, as well as 4 hours for the workshop. So far with these type of opportunities in orientation as well as through the workshop in Humber, we have more than 600 RNAO best practice champions in the building on different units, interprofessional. So success stories behind all this. So going back to the first question, when we asked them before starting the orientation, were you aware of RNAO best practice guidelines or spotlight organizations, or what is best practice champions role look like? Their knowledge is 39%. So after 8 days of orientation, you can see their knowledge is 96%. They're well versed now what is the meaning, because they have completed the RNAO e-learning module for best practice champion. They have attended 7 of the best practice guidelines throughout the orientation. And then we keep talking about these type of guidelines in every sessions at the beginning and what it means to us and what will be their role to sustain these best practice guidelines when they will be going on the units. So on November 21st, so our one of the indicator or one of the pre-survey question was, what is the goal? Because many times we feel like staff comes to attend, but they don't know what is their goal will be. So there was 70 people attended, 40 people attended. We asked, there were many, many examples. I have few examples here from those SMART goals. So they're looking for to enhance their knowledge. They're looking for, I want to learn and then I want to integrate, I want to guide others, and I want to promote patient safety. And then their goal was to refresh their knowledge kind of thing. So that was few examples of their SMART goals. And then the post workshops or post these type of open houses, their knowledge, their SMART goals, 97% staff members said they have achieved their goal, which was great for us going to understand if they came with one of the objectives to attend these type of workshops or open house, they were able to achieve those. And we did ask how they overall rate about the best practice champion open house, and then 85% said this event was excellent to them. And then thank you for the opportunity providing us over here. So improving opportunity, of course, this is our key piece to focus. So they want more interactive games during these workshops or open houses. They said we understand how the DTI look like on a lighter skin, but we want to see the models, which will be how it will be looking on a darker skin. And then they want, because they have a handbook, activity book, but we have a lot of PowerPoints. They want some resources from the PowerPoint, and then they also want to add some video to the presentation, not only the PowerPoint. So these 4 key opportunities for us as a leader who lead these open houses or workshops. to focus on something here. So this was in November. So when we did in March, we did improve. I mean, we did involve these. So you can see here in March when we asked that, they said it was more informative, it was more interactive, simulation piece was excellent, educations about hands-on was good. So we did integrate that, good content. It was interactive. Most of them said, because if you look at the first point, they were saying they want more interactive interactions in those. And we did start models of darker skin DTI in our orientation as well as in these type of workshops already. So we will be looking at the last point for the power from the video. So maybe in the future, that will be our goal, to have some kind of video recording for those things and then integrating in our workshops or in our orientation also. So the other success, what we measure is how much support or the satisfaction they got when they did the IPUP survey on that day. So they did say the BPSO leaders, they were very supportive. They also got a lot of support from their clinical practice leader at the unit level. They liked the model student nurses and CPL on the floor, and to have the 3 people's buddy team kind of thing. To do this survey. So that was very, very impressive. The 4.9 out of 5, we received that. We also asked how they were satisfied, how satisfied they were with the structure of this day. When we did the IPUP survey, they said day was very well organized. We did the pre-briefing before they go on the units, because the workshop happened on 20th of March. The survey was on 25th. So we thought, let's be pre-brief whatever happened on that day. They may have forgotten something. If they have any questions, we were able to answer, and then they appreciated that pre-briefing session in the morning. Debriefing we did definitely after the survey happened on the floor. So how was their experience? And then they felt that was also a good opportunity to share their feedback. And then we created a WhatsApp communication group during that day for faster communications, where they were putting questions if they were unable to do something on the floor from staging perspective or from a documentation perspective. So our clinical practice leader for wound and skin and myself, and then other clinical practice leader, they were right on that communication, and then they were answering the questions based on their knowledge. So some stories to share from their success on the 25th also. These are all 41 students. So it was led by students actually that day. And then we were very, very impressive of their hard work. So they did say the new knowledge obtained and then experience was great. This learning opportunity was great for them as a student. This was a great experience again as a colleagues and students. The survey made me understand more about pressure injuries, and I'm more confident now identifying pressure ulcers. So this was great to hear, like a student's knowledge was enhanced, and then they felt this whole activity or initiatives or day was very interactive. They liked it a lot because it was able to improve their knowledges. They said it was very well organized, and then they felt there was so much support available on the unit level, plus the BPSO lead over here, because every single question was answered in a timely fashion, which they did appreciate. So overall, how was the day? 94 people or participants said it was an excellent IPUP survey day overall experience. They did say the workshop time was 4 hours, and then it should be gone to the 8 hours. So we will look into next year when we do that workshop, if there is a need for 8 hours from their perspective. So what is a success story for Humber? So this is all for the participants. So how did we improve here? So if you look at there, so pressure injury, we measured the pressure injury screening assessment. So 98% of our admitted patients, they are screened for pressure injury risk on admission. And then right-hand side, this is our HAPI, which is our hospital-acquired pressure injury, but this is during IPUP survey each year. So starting from 2020, there was a 50 patients with a HAPI on that day when we did the survey. And then if we look at today in 2024, there was 3 sites. We have 11 patients with hospital-acquired pressure injury on that day. Again, this is a one snapshot for that one day, but this is how the results look like. So pain assessment, again, 95% patients' pain is being screened or they are screened for pain assessment on admission. And then 97% patients' goal for pain is achieved. This is one of the indicators we measure through our documentation software, which is a Meditech, if their goal is achieved by the end of the shift, whatever their goal was for that day. So 97% patients says their goal was achieved for the pain management. From delirium screening, you look at the results from January to June, so 97% patients 65 and above, they are screened for delirium on admission. And then on the right-hand side, this is our average. So average 3.3 per thousand care days is our delirium rate for 65 and older patients for admitted patients. For family-centered care, how many patients or how many family members are asked to participate in their care and treatment. This is one of the indicators we measure for a patient and family-centered care PPG. So 98% patients said we were involved in our treatment and care plan. And then for the complaint rate, we have average 4.99 per thousand care day is the complaint rate for our admitted patients. So for falls risk, again, screening for the falls on admission is 98% for our patients, and falls rate is 3.4 per thousand care days. And then for best practice medication, best possible medication history, 93% on average for admitted patients on admissions. And then for transition of care, we use smart discharge protocol or smart discharge packages, which are started on admissions. So 80% patients, they receive smart discharge educations as well as family members upon discharge during the length of stay. So the next objective, going back to the third one, fostering a supportive learning environment where participants can exchange their ideas for best practices and developing champions within their team. So for this, as you have seen, we have strategies for the interprofessional team practice, best practice champion open house or workshops. That's one. The second one is we also do interprofessional preceptor mentorship workshops for our staff members. It's a 4.5-hour workshops, and our goal is 4 per year. That's how we support them. And then resource persons, team leaders, supervisors, or charge nurses. We have 2 workshops per year for 8 hours. These are all education paid time. We also involve our best practice champions, preceptors, mentors, and resource persons in our quality improvement projects. So that's where they bring their ideas, and then they will be sharing and exchanging those ideas. So how we did that? So every year from Humber River Health, we produced many quality improvement project IHI abstract posters. So these are examples just for best practice guidelines or BPSO. So a year before, so in 2022, we were able to develop 4 IHI abstract posters based on best practice guidelines, what we have done in the building. So last year, we have done 1 poster on best practice guidelines, promoting patient quality care through physical assessment competency at Humber River Health. So in this competency or in this poster, we talk about pain assessment, best practice guidelines, as well as pressure injury assessment and management. So these are not only by the leaders, this is our interprofessional team contribution for these posters. So our next step here, so as an RNO designated BPS, so we are committed to focus on sustainability, continue implementation and evaluation of best practice guideline. So we are working with our teams for the substance use as well as ostomy care, and then developing our staff for the best practice champions. So we have different strategies starting from orientation through the open houses, through the interprofessional workshops, as well as resource nurses workshops, and then disseminating our BPSO work through social media. And recently, we also felt like public visibility, we need to enhance it. So we did 2 strategies here. So for public visibility, we created this banner, which is on our digital monitors. So in Humber, as being a digital hospital, every patient's room on inpatient units, there is a digital monitor outside the room except mental health. So this banner is on each digital monitor. So more than probably 700 digital monitors are in the building. So this banner is continuously going on with other 2 banners. So this talks about Humber River Health is proud to be best practice spotlight organizations. And we also implemented BPSO logo in our all employee signatures. So these are the other 2 banners over here. So Greater Toronto Top Employee as well as accreditations. And then the third banner is this BPSO. And then we integrated this little logo here under the employees' signatures to make it more public visibility. Next step is in our patient's room. In patient units, we have a communication board. So we are in a kind of a assessing the board's requirements in the rooms, and then probably we will be adding a BPSO logo on those boards also for patient and families to have the visibility there. Thank you very much. We are opening for the questions.
Oh, thank you so much, Gurmeet. That was an incredible presentation, so impactful on your journey of empowering champions. Over 600 champions from a variety of healthcare roles. They're all working together for a common goal of improving the quality of care. It's very exciting. I really love how you've woven the champions' knowledge and training right from day one through the orientation. So it's very exciting. Thank you for sharing. We do have a few questions, and I would like to begin here. It's a three-part question. So I'll just read it slowly here, and Gurmeet, then I'll hand it over to you, and we'll carry on from there. This is asking what you enjoy most about working with champions and how you see champions making a difference at HRH. And what is HRH doing to have so many engaged and active champions? I'll hand it over to you. Thank you.
All right. So what I enjoy the most working with them, when I see the knowledge is enhanced, because in this role, my goal is probably from nursing perspective, every nurse should be a champion. Every nurse should be a champion what they do at the bedside. So when I see that knowledge is enhanced, and then they are taking all that positivity from here and then doing it as something on the floor which is making a difference. So such as, for example, assessing a wound correctly, identifying correct dressing for that wound, screening the patients for falls risk, and preventing those falls. That makes me happy. She was able to make a difference by the end of the day by preventing that fall, not only for the floor or the number perspective, but also patient care perspective, right? So what we are doing to engage them, we do so many activities. So we do these formal activities, plus we also bring some celebrations. So this year on 31st of January, we were able to celebrate our 5th anniversary of the best practice guideline, where we invited all our champions who were present on that day to honor them. So there are different strategies we can do at the unit level. So on the units, we have a quality improvement boards outside the nursing stations, near the nursing stations outside the patient's room. And then we also have our champions pictures on that board. So anybody walking through the hallways, patients and family member, they see person's face and person's name. If that person is that family member's who's a patient's nurse, they feel like, oh, my nurse is a champion for something. It was written on the board, right? So it empower them. And then when they have a communication with the patient family member, oh, I see your picture there. You're a champion for this. This makes them to do something more extra for their patient, right? So this is what I see. And then that makes me happy. These individuals are on the floor and they're making a difference in somebody's life over there.
Yes. Wow, that's wonderful. Empowering for the employee and empowering for the patient. That's wonderful. I encourage others to place their questions in the chat, please. We do have some time to answer some more questions. Gurmeet, I have another question here. What steps will you take to foster a culture of excellence and continuous improvement within your team or department?
So in order to fostering a culture of excellence, I believe we may be looking for some other different strategies, maybe having some, right now the champions are kind of, they may be champion for 4 different BPG, right? So they may be champion for all BPG that are interested, but there are certain individuals who are expressed the interest to be a specific best practice guideline, if that's relevant to their area. So for example, our women and children program, they have a breastfeeding best practice guideline. So there are champions who just want to focus on that. So that's what is my next step is if we have a champions or we have a participants who wants to just have a knowledge for one best practice guideline because that's relevant to their area. So we are going to have those working groups within those programs or those units. And then also during the open house, rather than having a corporate best practice guideline, which was the focus for last one, triple D, pain and falls and pressure injury, which is a corporate, bringing these individuals into those open houses and presenting from their perspective. So even though breastfeeding may not be the best practice guideline relevant to all inpatient units, however, they will be able to get the knowledge from this group of individuals from Women and Children program, how this was implemented, and then what they're doing about that BPT. So we want to enhance with the specialty areas. Same thing for substance use. So our first focus is mental health, creating a champion from there, and then disperse that work to the other units.
Very good, thank you. You have shared so much, but I'm just wondering if you could share an example. This is, so much work for the organization and in the work that you've done with champions, but could you share an example from your experience where empowering individuals to become best practice champions significantly impacted the quality and outcomes, either of a project or an initiative?
Yeah, so last 2 semesters ago, we have a student who was our own student, and then not sure if that student, that staff member is attending. If so, I will encourage that participants to speak about it a little bit. So this is our own staff who was in a bridging program. So they were placed here with us in our simulation area. So this staff was assigned, for example, to do some auditing for the pressure injuries documentation perspective, right? It was his colleagues or her colleagues' documentation, but saw a different perspective, right? And then where the gaps were. So for example, gap is no documentation, for example, for pressure injury on admission. There is a documentation and there is a gap, and then there's a documentation again. Or there is a stage 2 first and then stage 3 and back to stage 1 or 2, right? So fluctuating documentation of staging, for example. So student was able to identify all those gaps. And then when we did the IPUP survey workshop on March 20th, that student was able to present his experience and what he's looking for from the staff or from the colleague. So it was very powerful in my perspective because it's coming directly from a colleague, not from a leader, what that colleague has seen and what he wants other staff members or colleagues to correct it. So that was very, very powerful for us.
Yeah, it's very powerful, and especially for the student to have that opportunity to be heard and identify, where there might be a gap and how to move forward as a team to address that. Yeah, that's amazing. Is there any other questions that we have? Any other final comments that Gurmeet that you would like to leave us with? We thank you for your time. It's been incredibly empowering. I have a comment here in the chat on how they're sharing that the presentation was so helpful, and they had picked up on a lot of tips and concepts that you had shared. So I'm sure many are feeling that way, as lots of thanks are coming in for the presentation. Do you have any final thoughts or words?
Yeah, I just want to say, if sustainability is a hard piece, right? So keep encouraging your champions, bring them back. If there is opportunity, even, so for example, we did the medicine skills day, and then this time we did not integrate it, but definitely next time we are thinking as a leader to bring those champions to present rather than a clinical practice leader present the whole PowerPoint or whole session. So maybe bringing some champions there to do some presentations, so that will help them to value even up kind of thing. Yes, I did this workshop last year, now I have a knowledge, and then this is how I'm going to do. And then we have seen that staff members learns from colleagues faster than anyone else kind of thing. If she can do it, why not me, right? So this is what we are thinking to integrate in our next educational days. If any organizational leader wants to have some kind of planning or structure for the workshops or the open house, or how this was integrated from orientations, definitely I can help and I can support that.
That's wonderful. I just want to echo all the comments in the chat. Gurmeet, I'm not sure if you can see them or not, but there's many, many thanks on your expertise and echoing, you're a champion of champions. And that is so true. And we thank you for all the work you're doing. And we thank you for the work of your champions, over 600 of them. And I know that's only going to grow more and more. And so that will be the end of the presentation today. Again, thank you everybody for joining us. And Gurmeet, thank you for your time. And I hope to see you again.
Thank you so much for
Bye for
providing
now.
this opportunity. Yeah, thanks.
Thank you. Bye for now.
Bye.